Will the next patient please come in? Hi, what brought you into the ER today?
Hi, I've been experiencing some intense abdomen pain. It started about 4 days ago. It was not that intense at first, but now it's unbearable.
Okay, I'm gonna have you lay on your back and I'll take a look.
Okay.
All right, let me know when it starts to hurt.
Ah!
Right there?
Yeah.
On a scale of 1 to 10, how would you rate your pain?
It's a 9.
Okay, I'm gonna have you sit up. What other symptoms have you been experiencing?
Well, I was diagnosed with cancer 18 months ago. I'm not in remission for that, but I recently noticed some blood in my stool. So with that and the abdomen pain, I immediately came to the ER.
All right, well, I'll send in the order for some tests and we'll see what happens.
Okay, thank you.
Coming in today, I called you two in as the patient's oncologist. I just wanted to get a feel for the patient before starting the second round of treatment, just see what you guys had to say.
I was our patient's nurse this morning, and up on the whiteboard are his past medical history, information about the first round of cancer, as well as the recent test results. He mentioned that there's no familial history of cancer, but his sister, dad, and himself all have type 2 diabetes. A little bit of background information about the patient is he's a university professor, smokes about 3 to 4 cigars a day for about 20 years, drinks 2 to 3 cans of beer every night, as well as 1 glass of sake, and has little to no exercise.
And I'm actually his general practitioner for the past couple of years. He's actually at a bigger risk for getting cancer again because he already had it once, and he has a very poor diet with sedentary lifestyle. And recently he came in with new symptoms. It appears that the patient is tender at the costal margins, has enlargement of the liver, mild swelling of the peritoneal cavity due to fluid, and red blood on his stool. I sent him to get a few tests done because he already had colon cancer, and we scheduled tests in radiology to see what happens in his blood samples.
Right, I was reviewing those samples earlier and I noticed 7 abnormal lab tests that came in. I saw that he had abnormal levels for CEA, AST, ALT, LDH, and abnormally high levels of bilirubin, and his albumin and protein levels were actually really low. The CT scans I saw showed about 12 to 15 hepatic metastases, which is an advanced sign of colon cancer. I believe that the treatment he should go forward to remove the metastases, followed by drug therapy using the fluorouracil and the cobarin that was used previously in his first. Since it was performed in his first cancer treatment, I think it will suffice for this next treatment, and yeah, it should work pretty well.
It's been a few weeks after his second surgery, and he has lost weight. He has no complaints of headaches, shortness of breath, weakness, fatigue, or wheezing. He claims soreness, but there's nothing overly concerning.
I'm really glad to hear that. Had he had some of those symptoms, the survival rate would have been really bad going into the next 5 years, but since he's looking pretty good, he's got a 90% survival rate now and just a positive look ahead. To continue in his recovery, for optimal recovery, he should continue to do about 30 minutes of exercise, low to moderate, for about 3 days a week.
All right, so in summary, I'll just tell him to maintain a healthy lifestyle and be aware if anything unusual pops up.
Sounds good.
Abdominal pain, bloody poop, signs of cancer. Better lose some weight.